already had a knee replacement, and I don't think it worked out too well. And now he started having hip pain, and he was trying to avoid a hip replacement. So 2 years later, let's see how Jim is doing after the procedure. Let's give Jim a hand for coming out today.
Hello everyone, my name is Jim May. I'm 76 years old. I was 73 when I first met Doctor. I don't get any compensation for being here. Yes, I do. My personal philosophy is every day leave the world better than you found it. And so this is my way of doing something for you. Just as somebody who spoke here the time I visited Doctor's seminar, he encouraged me to have the procedures. Before my 2 years ago, or before my hip procedures, I came to Doctor with neuropathy in both my feet. So you saw all of the symptoms that were up here: burning, tingling, can't sleep at night. Doctor gave me Lyrica. I only took one pill, and I closed my eyes in the shower, and I almost fell over. And then gabapentin was about the same. And so after 3 treatments of the lasers, which Doctor recommended, 6 series of 6, about 1 every 3 days, my neuropathy was gone. I finished up with 3 more. And if I remember correctly, I said I never want to have this happen again. You know, Doctor is a left-handed compliment for Dr. Yu, but he's like the choice of last resort. After you tried everything with your doctors, then you finally end up coming here. And it's crazy because you'll know when you need to have a decision because you have so much pain and anxiety over it. So I came, I think, one procedure in the following 3 months because I just wanted to never have that happen to me again. A year later, I had developed a hip problem, and I did have a replacement left knee, and I thought I'd see Doctor, and in the meantime, I had a right knee problem. And the x-ray showed I had bone on bone. So after a few I think I had 1 or 2 laser treatments to get the blood flow going to see if we could rebuild the cartilage, I just asked Doctor to provide a stem cell procedure for me. And so I had that, and I'd say the stem cells are like workmen. They come and they call in all of the fresh cells to repair your cartilage. And I think about 3 weeks later, I was totally cured. I mean, I had a total change in life. Not only that, your mind, your mentality, your outlook on life just totally changes. So I'm very happy to have come here. If you have any questions for me as a live patient, I'd be glad to answer them. Anybody at all? Yes, ma'am.
Was there any pain in the treatments?
I'm sorry, would you repeat?
Were the treatments painful?
No, not at all. First of all, the neuropathy is just lasers, and he has some other things he does with magnets, and mostly light treatments, non-invasive. And the stem cell is about the tiniest little needle I ever saw.
Yeah, stem cells are so small.
Yeah.
We use a very small gauge needle, and we spray ice on his hip. Ice spray, it numbed it. Maybe it feels like a mosquito bite. Okay.
Not even that, really, in all honesty. And it's over at that point. And then he accelerates the rebuilding process, I believe, with laser treatments. It's all included, and it's absolutely amazing. I'd encourage you to at least go for a consultation.
So the treatment never has to be repeated once you go through it?
I'm sorry, would you repeat that,
You
please?
never have to repeat the treatment?
No, that's it. And, both the neuropathy, 3 years later, I'm fine. And as far as the stem cell work, it seems to have been perfect. And the x-rays I saw, like he showed on the thing, where, my bone to bone, and they're probably now got some separation.
All right, let's give Jim a hand. He'll be here for questions later.